Have you ever have sudden fever? That's fever that just starts spontaneously. Body pain, headache, and catarrh, dry cough. That could be flu. Because flu is a viral infection that affects the nose, throat, lungs, and can cause body pain. Symptoms of this flu include high fever. Remember, sudden high fever, sudden onset of high fever, body pain, headache, muscle pain, fatigue or extreme weakness, sore throat, runny nose, and in children, diarrhea and vomiting and nausea as well, shivering, chillness, loss of appetite. All these are signs of flu. Your child or you may be battling with flu, not just common cold. How is this flu spread? Through coughing. If somebody that has flu cough near you, it can give you flu. Then sneezing. When somebody sneezes around you without covering his nose, it can give you flu. Then close contact with somebody that is suffering from flu infection. Then touching contaminated surfaces are always flu can be spread. Then who are those people that are at risk of getting flu? We say elderly people because their immunity is getting low. Pregnant women too, they are low in immunity because they are pregnant. Young children that their immunity has not fully developed, and those with chronic illness, that is people with long time illness that are battling long time sickness. How do we prevent this flu? As I said, I am Dr. Prevention is better than cure. I love prevention. I have power for prevention. So the best way, the first line of option when preventing flu is vaccination. There's annual vaccine against flu. Then the second line is hand washing. Regular hand washing. Of course, you agree with me that even WHO has made it clear that hand washing alone can prevent us from getting sick 99%. So regular hand wash, because all these germs that give us sickness come in contact with our body through hand, what we touch, the car door, the stairs door, the door in your house, the surfaces in our house, all harbors all these germs and viruses and bacteria that can contaminate our body. So hand washing is key. Then we should avoid close contact with sick people. There's this practice that somebody is sick. Hey, you want to tell me sorry? You could be in the hospital, or if somebody is still taking medication, you just have to hug the person. No, it's not love. When you love this person, give him space to recover so that you yourself will not get this sickness and transfer it to others. Then treatments of this flu include rest, bed rest. You need to rest. Then take a lot of fluid. Then antipyretic like paracetamol that can relieve fever is also among the treatments. Then in severe cases, antiviral drugs can be administered. Then in such cases, one important thing to remember in treatment of flu that antibiotics does not work. So even the antiviral, all these treatments, it's not something you do at home. Please visit your healthcare expert, go to hospital. Why I make this video? Because a lot of women keep calling me. My child has been having catarrh for more than 1 week, more than 2 weeks. I've treated malaria, the fever has not gone. The baby is still running fever. Mama, papa, my lovely mothers, beautiful mothers, and people around. Fever is not only caused by malaria. High fever, headache, vomiting, diarrhea is not only caused by typhoid and malaria. No. I want you to know today there is something called flu, which is a viral infection that is bigger than your common cold, that the ordinary catarrh we know and cough that we know. No, this one is more way bigger than that. Because it's a viral infection, it's not something you can just say it will go. You can just treat with antibiotics. No, you need to know the difference so that you know what you are treating. Next time a child comes up with fever, then you need to solicit help, medical attention, so that they will be able to distinguish what is wrong with the child, then you know the treatment to give. That is why I make this video. Please, mother, adhere to this. There is something called flu, and just as I've said, I have energy for prevention, which will agree with me that prevention is better than cure. as a public health advocate and consultant, I stand with prevention. Because prevention, the thing will not even come up. Talk more of now thinking of treatment. When we know all these preventive measures, we can prevent anything before it comes. So prevention is better than cure. People, we should know what we have to know what flu is before we know how to prevent it. And hereby we have said that there are lines of prevention for flu. In our next video, we are going to discuss categorically topics on the vivid differences between flu and common cold, that's the ordinary cough and catarrh we know, and what to do, the vaccine, how many doses, how it's being taken, where to get it. We're going to discuss about it and how it prevents flu infection for a season. Whether is it a live vaccine or is it a seasonal vaccine? Is it a vaccine that when you take, it can cover you for flu for the rest of your life? Or for how long will the flu vaccine help prevent this flu infection in you? Thank you. Till we meet next time, please drop any question you have on the comment section and I will treat it, because I still remain your doctor. Prevention is better and cheaper than cure.